So welcome again, and we will talk now about the types of dementia, which is very popular. And we will go for more details about the types of dementias, including also slides and PowerPoints and videos that make it very closer to our own brains, how to deal and how to know just things more about the dementia and the dementia types. So now we will talk about the dementia types, and this is the video is about this part. Actually, we have two types of dementia, what we called before, like I said before, reversible and irreversible dementia. The reversible dementias like the depression, delirium, emotional disorder, metabolic disorders, eye and ear impairment, natural, any deficiencies like degenerations or whatever, tumors, infectious, alcohol, drugs, and so on. Once it's healed up or recovered, the reason is gone, then everything is back to normal, and this can be recovered. This type of dementia is a temporary and can be recovered back. The point is not about this type, but the dangerous types is that the irreversible one. The irreversible dementia is a kind of dementia which is not able to get the patients back to normal, never get the patient back to normal, because in this kind of dementia it's a progressive one. So here, this is including the Alzheimer's and Parkinson's, and those are the main, plus the known other to the front temporal. The front temporal also is one of the dementias, but it's rare, not too much. And I said before in the previous lecture that the Alzheimer's is around 60 to 70% of the people who are affected with the dementia or Alzheimer type or Alzheimer type of dementia, Alzheimer disease. And about 10 to 20% vascular dementia. We will see now today what is the difference between the Alzheimer and the cardiovascular, or the vascular, and the frontotemporal dementia, and the dementia with Lewy body, which is the most very famous ones, the major famous four types of dementia which affect the person. Here we go for the types of dementia. We have the Alzheimer's. This is the first one. Here we go, the Alzheimer disease. Small clumps of protein known as plaques begins to develop around the brain cells. This disrupts the brain's normal working. The vascular dementia, it happened most of the cases because of a stroke. And a stroke hit one of the places in the brain based on the location which will hit, and it will cause problems, impair problems in memories and vision and so on. Dementia with Lewy bodies. These Lewy bodies are abnormal structures which develop inside the brain as well. And the last one is front temporal dementia, which we'll talk about today. There's also Jacob dementia, but those are the main types which we will give a hand for. I just want to go right now into, like I said before, just to remind you, my dears, that the Alzheimer is around 60 to 70% of the cases of the dementia is Alzheimer. 10 to 20% of the cases of dementia is vascular. Around front temporal, around 10%, and dementia with Lewy bodies like around 4%. And we will know today the difference between each type and the other type of these types of dementia. Here we go right now, and those are the four types which I talked about just now, and I will go for the first one of them. The first one is Alzheimer disease and related dementia. Alzheimer disease. Alzheimer, the most common form of dementia, we said like around 60 to 70% of the people. Or in the Canadians, between the Canadians, like around 64% of the Canadians who has dementia is developed by Alzheimer. Usually occurs after the age of 65, is often diagnosed after the age of 80. However, it can also affect people in their 40s and 50s, but it's not a big ratio. Most of the people who are aged 65 and above, those are the ones who's complaining from the Alzheimer. But what does the Alzheimer do in the human body, or what is the science The early signs of Alzheimer, which when the patient complain from one of these signs, or one or more of these signs, doctor will suspect Alzheimer. First of all, the memory loss, changes in mood, misplacing belongings. Like as example, I put the car keys inside the oven, or I put instead of putting the dirty socks in the dryer, I put it with the clean clothes, or I put it in the refrigerator, and so on. Hard to complete familiar tasks. As example, you were playing cards in the past. Now you cannot play the cards or domino or whatever. Things which you used to do in the past very simply. Now it's very hard for you to do it. Confusion of time and place as well. The confusion of time and place. You are confused about the time. You don't know the days of the weeks. Is Monday before Tuesday or Tuesday before Monday, and so on. Social withdrawal, and this is one of the points also in the Alzheimer, which is one of the signs, early signs of Alzheimer. You start to get out of the, like we said before, we have the Maslow needs for humans needs of the Maslow pyramid. We said comes on the bottom of that of Maslow. We come on for the physiological needs, then the safety needs, then the social needs. Social needs here are the needs of belonging. Like you like to have friends, you like to have beloved, you have to like to have a wife or a girlfriend or whatever. In that case, you start isolating yourself from these belongings. The social needs here goes down. Poor judgment. The poor judgment also for the things. As example, in the winter time, you go with very light clothes outside. And in the summertime, you go with heavy clothes, with the winter clothes. You put on winter clothes in the summertime, and you won't put on summer clothes in the wintertime, and you put winter clothes in the summertime, and you go out like disorderly. Struggling to communicate, sometimes also is not able to communicate with the people, and changes in vision. This is also one of the points which shows there are aspects of Alzheimer's. We can see here now Alzheimer's disease. We compare between two parts of the people brains. This is on the left side here. There is a healthy brain, and on the right side here there is Alzheimer's disease brain. Like you see here right in front of you now. Let's get like you see in front of you here, the healthy brain, cerebral cortex is here. Like here, you can see it, this part. And you can see this part here now in the cortex. So the cortex here, responsible for language and information processing. This is the cerebral cortex. This in the Alzheimer's disease brain, the cortex shrivels up. Okay, damaging areas involved in thinking, planning, and remembering. So these are the things which will affect here. Second point, the ventricles. Ventricles on the left side, like what you see here for the normal brain or for the healthy brain. This is the healthy brain. Look at the ventricles here. Filled with cerebrospinal fluid, grow larger. So now here it's small, like what you see here, but here it grow larger and larger. Third thing, hippocampus. The hippocampus here critical to the formation, to the information of new memories. This part here, the hippocampus shrink. The shrinkage, make a shrinkage, is coming smaller now, and it's coming a little bit. In general, there is a shrink in the brain, as well, and that's one of the reasons that cause the Alzheimer's disease. So here now we will go right now into. Actually, we'll go to this link and open link here right now. Okay, and just watch this video about the Alzheimer.
Alzheimer's disease is a brain disease. Progressive disease is irreversible. People with Alzheimer's. Alzheimer's is the most common cause of dementia among people aged 65 and over. Dementia is loss of the ability to think and remember things that is severe enough that a person has trouble doing day-to-day activities. About 5.8 million people in the United States have Alzheimer's disease. Rarely, people younger than 65 can have Alzheimer's. This is called early onset Alzheimer's disease. Around 1 of every 20 people with Alzheimer's have early onset Alzheimer's disease. You're more likely to get Alzheimer's if one or more of your close family members, parents, brothers, or sisters, has it. The most common early symptom of Alzheimer's disease is trouble remembering recent events. Other early symptoms may include having trouble completing daily tasks and getting lost when driving on a route the person used to know well. These symptoms are not the same as normal forgetfulness, which can happen to all of us as we get older. For example, if you sometimes forget about an appointment, forget a person's name, or misplace your keys, it doesn't mean you have Alzheimer's. A person with mild Alzheimer's disease may need help with usual tasks like managing finances, planning meals, and keeping appointments, have trouble sleeping, and become anxious or depressed. As symptoms of Alzheimer's disease get worse, a person may have trouble recognizing family members and friends, need help with daily activities like getting dressed, become fearful or suspicious.
Just I want to say something here, guys, about the role of the personal support worker in this time. The role of the personal support worker, as our curriculum is telling us, the movement is from completely independent into completely dependent person. I'm talking about the patient or the client who has Alzheimer. In that case, the PSW rule will from a partially rule, like we will see the partially activities like supporting, giving a hand and so on, into totally 100%, even to the assistance in moving and the mobility of the patients in the last stages, because you will not be able to move, you will not be able to sit down, you will not be able to turn himself or whatever. So he need a posture, he need a left and posture. In all the cases, turning his own place every 2 hours and so on, which was the clinical part. We will see in the clinical part of this curriculum. So that's what I want to say here, is that the patient of the Alzheimer moved from 100% independent into 0% independent or 100% dependent. That is the difference for the patient of the Alzheimer in that case. Let's go back and complete this video because it's very important. It shows us also how everything is going right. Okay.
Suspicious of other people, or believe that they are seeing or hearing things that aren't real. When Alzheimer's disease becomes severe, a person loses much of their ability to communicate and needs full-time help to take care of themselves. Doctors don't fully understand what causes Alzheimer's disease in most people. Most people with Alzheimer's disease are older, but just getting older doesn't cause the disease. Many people live well into their 90s without getting Alzheimer's disease. Carrying a variant of a gene known as APOE increases a person's risk for Alzheimer's disease, especially the late onset form of the disease. But not everyone who has this gene gets the disease, and people who don't have the gene can still get the disease. Early onset Alzheimer's disease can also be caused by an inherited change in one of 3 other genes, yet these genes are very uncommon. Other conditions that may increase the risk for Alzheimer's disease include smoking, diabetes, high blood pressure, and an unhealthy diet. Doctors now know that changes begin happening in the brain 10 to 20 years or more before a person with Alzheimer's disease shows any symptoms. Neurons are brain cells that send and receive signals to and from the brain. Everything we do as living beings, walking, thinking, forming memories, happens because of these signals. A healthy adult brain contains about 100 billion neurons. When a person has Alzheimer's disease, tiny pieces of a protein called beta amyloid build up in between neurons, forming clusters or plaques. Another protein, called tau, builds up inside neurons, forming dense, thread-like tangles. Together, these plaques and tangles block neurons from sending and receiving signals. Because of these and other abnormal changes in the brain, neurons start to die. The first place this happens is in the parts of the brain where memories are formed. As more neurons die, the brain starts to shrink. As Alzheimer's gets worse over time, the brain may shrink to about a third of its normal size. Mixed dementia is dementia that's caused by brain changes due to Alzheimer's disease and one or more other brain diseases. For example, a person may have dementia that's caused by both Alzheimer's disease and Parkinson's disease. A person may also have both Alzheimer's disease and vascular dementia. These types of dementias occur when the brain gets less blood than it needs. This can happen after a person has a series of small strokes. Studies show there are steps you can take to reduce your risk of Alzheimer's disease. Don't smoke, keep your body and mind active, stay in touch with family and friends, and eat a healthy diet. Maintain a healthy weight, control high blood pressure, drink alcohol in moderation, drink coffee in moderation. Recent studies suggest that getting vaccinated against pneumonia and the flu can also help lower your risk of Alzheimer's disease.
This video, I put for you the link inside your own PowerPoint. And the PowerPoint also, you will have the links there. And like you see here, it's like the problem of the neurons. Neurons will not be able to send the messages. Then the neurons will die. And after the neurons will die, the brain will start to shrink. And this is the reason why, and the first places to be attacked in the memory areas of the body. That's what we get from this video, actually. And it's a very lengthy video. I just want you to watch it once, twice, or 3 times again. And that will help so much also in our work. So that was about the Alzheimer. Let's go back into our own parts. Let's go to our parts back here to our PowerPoint. This is regarding the, let me show. Okay, now the warning signs of Alzheimer. The warning signs, like it's shown in the video, and also here it is memory loss, difficulty pertaining the, here we go, difficulty performing familiar tasks also, problems with the language, and difficulties words or substituting words that's not in the context. As example, I don't know, this is the spoon, and I say about it fork or something close by. I say about the dish or the plate that it's a cup, or another names. Just I will put for it another names, but not the real names, which is supposed to be. Disorientation also. The disorientation is time and space, not knowing what day of the week, and as not getting lost to the familiar places. Usually you go to the hypermarket, is very close by, or the mall, and you know the way. 30 years you are doing this. Now you are confused. Or when you are paying, you forget about your passwords. When you go to the to pay with your own bank, the credit or the Visa or something, you can't remember what are the numbers of your Visa and so on. So these things always symptoms also of impaired judgments, like not organizing medical problems, need attention, wearing light clothing in cold day, like we said before, problems with abstract thinking as well, not understanding numbers, significant and calculations. You cannot calculate, you cannot say 1 + 2 = 3. That needs from you big effort, so on. Misplacing things, putting the things is not in its own place, and it's not in the proper place. Putting things in strange places, like an iron in the freezer or wristwatch on the sugar bowl. Change in mood and behavior as well. The mood and the behavior change. We said also the isolation from the society will start here. For example, going from being easygoing to a very quick-tempered person, from easygoing to a quick-tempered person. Changes in personality as well, behaving out of character, such as feeling paranoia or threatened, rather threatened, loss of initiatives, losing interest in friends, families, like we said before, trying to avoid the people or trying to get away from the people. Not like before, not like what you used to do before, avoiding the people or living in isolation and so on. That was about Alzheimer or Alzheimer. And say we said, just so for your information, it was discovered in 1906. And the second type of dementia is the vascular dementia, a vascular dementia. And the vascular dementia, sometimes known as multi-infect dementia. One of the most common forms of dementia, secondary, only the Alzheimer's disease in older adults. Just let me take you back into the types of dementia which we talk about here on this slide. And to remind you that this is the part of the vascular dementia. This is the part, like you see here, this is the part of the vascular dementia. And it's like you see here in front of you, it's like around between 10 to 20% of the whole cases of dementia. Alzheimer, of course, comes in the first place, then the vascular comes in the second place. Vascular dementia comes in the second place. So to get into like around 10 to 20%, and the reason here is a stroke, mainly a stroke. Vascular dementia, sometimes known as multi-infarct dementia, is one of the most common forms of dementia, second only after the Alzheimer, of course, in older adults. Vascular dementia is caused by chronic, look at this, chronic reduced blood flow. The problem always in the vascular dementia is the blood flow to the brain, usually as a result of strokes, series of strokes. Okay, cool. Vascular dementia results in subtle progressive decline in memory and cognitive function caused when the blood supply carrying oxygen and nutrients to the brain is interrupted. I think this is very clear here. It's very clear. I guess, guys, it's very clear to you. Very, very clear. Again, I will say it results in subtle progressive decline in memory and cognitive functioning caused when the blood supply carrying oxygen and nutrients into the brain interrupted. Means no enough blood goes to the brain. The blood is carrying the oxygen and the nutrients. So less oxygen is going to the brain and less nutrients, food, is going to the brain by blocking this diseased vascular system. I will just see now. It may come or gradually or suddenly. This is for the vascular dementia, one of the main aspects or characteristics of the vascular dementia, that it might come gradually or suddenly. Gradually or suddenly. And the speed of the progression varies from one person to another person. The speed of the progression varies from one person to another. And this is another point, because the dementia itself, the vascular, it's the progressive goes more based on the blocks and based on what happened and based on the case and based on how the amount of blood which goes into the brain. Okay, does it have symptoms? If there is any symptoms for the vascular dementia? Yes, there are symptoms for the vascular dementia. Like the first of all, the poor judgment. It's a kind of like any other dementia, like memory loss, hallucinations, imagining things and so on, misplacing things. Like you see, a common factor between all the types of dementia, reduced language skills, difficulty in organizing, personality changes, like changing the mood and the temper. We said this also in the Alzheimer's. Inappropriate behavior, aggressive behavior, or whatever, or moved into a bad temper or a temper person instead of easygoing person into another kind of personality, and so on. But the most of them is the memory loss, because we say always these types of dementia usually attack the memory part. I will go right now into see what is the vascular dementia and how it will affect on the body. Please go to like this, then open link. Open link. I put for you, then okay. For me, it's like this. You can take it, copy and paste. Let's see this small. Usually my videos are very short. The videos which I expose here is very short, and it show you the case.
What is vascular dementia? Vascular dementia is the second most common type of dementia. It is caused by problems with the blood supply to the brain. Nerve cells require oxygen and nutrients by a network brain is interrupted, for example, by a sudden blockage or a leak. This is called a stroke. A stroke can cause significant damage to parts of the brain. When the parts of the brain responsible for memory, thinking, or language are damaged in this way, a person will have difficulty remembering things, thinking, or speaking. These are all symptoms of vascular dementia. Sometimes, a single large stroke is enough to cause the symptoms of dementia. This is known as post-stroke dementia. This scan shows damage to the brain of someone with post-stroke dementia. In other cases, a person may experience a series of smaller strokes that gradually cause damage. This is known as multi-infarct dementia. Following a stroke, a person's symptoms may remain constant for a while. Then, if the person has another tasks down into smaller, there is a narrowing of the. Following a stroke, a person's symptoms may remain constant for a while. Then, if the person has another stroke, they may notice a sudden worsening of symptoms. This is known as a step-like progression. Small vessel disease is where there is a narrowing of the blood vessels deep in the brain. Small vessel disease is the most common cause of vascular dementia. As the narrowing affects more small blood vessels and more of the brain becomes damaged, the person will experience a gradual loss of abilities. Usually, people with small vessel disease notice a slowing of thinking and problem solving. For example, taking longer to think of a word and write it down. Evidence suggests that lifestyle factors that promote a healthy blood supply, such as regular exercise, not smoking, and eating a healthy diet, could help to reduce the risk of vascular dementia. There is currently no cure for vascular dementia. However, by controlling underlying cardiovascular diseases which affect the blood supply, such as high blood pressure, high cholesterol, and heart disease, it may be possible to slow down the progression of the condition. Vascular dementia will affect people differently, depending on the parts of the brain that are affected. However, a common symptom is having problems with planning and organizing, or with concentrating. It can help to break complex tasks down into smaller steps, and to make sure that environments are not too busy or noisy.
That was about the review here, so you can watch it. You can also go to it back in a time and just watch it. That will be fine, my dears. Cool. Symptoms of vascular dementia, like we said before: slow thinking, memory problems, unusual mood changes, like happening depression or irritability. Person will become nervous, hallucinations or delusions, disorientation, which may get worse at night. Yeah. Me, myself, personally, I have experienced this situation with a person had a vascular dementia. In nighttime, usually we were very aggressive. Personal changes and loss of social skills. Social skills, like we said, the skills of belonging. And this is another problem also happening here in the vascular dementia. Move now into dementia with Lewy body. Right. What about this kind of dementia? Is it very common? No, it's not very common. Is it the percentage of this kind of dementia is very high? No, actually, This kind of dementia is rare, is not too much. How did I know? We'll go back into the chain which we had before. We are now on slide 40. Let's go back to see here the chart which we know about the dementia with Lewy bodies. Look at this, 4%. The slide of dementia with the Lewy bodies. Here it is only 4%. Only 4%. Like it's round. It's not an acute number. Like it might be around this, but it looks in the majority. Like when you see the slices here, comparatively, the first type of dementia is caused by Alzheimer. Then the second type is called bivascular dementia. And the third type is front temporal, and we will talk about it right now. And next type, or the lowest, one of them is dementia with Lewy bodies, which is around 4%, which we are talking about right now. Here it is. Let me just pinpoint to it this part. This part is the dementia with the Lewy bodies. You can see now it's very small, tiny, 4% only of the total dementia percentages, only around 4%. So we'll go back now into our slide 40. Slide 40, we'll go to the slide 40 right now and go back into, this is the vascular. We finish the vascular and symptoms of the vascular. Here we will go now to the dementia with Lewy bodies, like what you see here in front of you. Dementia with Lewy bodies, DLB, is one of the most common types of progressive dementia. Progressive means no way back, like we said before. Once it's gone, the patient has it, his case becoming worse and worse. Never been back to track, or never been rehealed, or never been, and so on. The central features of DLB is progressive cognitive decline. Skills of the brain goes down, combined with three additional defining: severe fluctuations in alertness and attention, fluctuation in the attention, for example, sleep disturbances and frequent. The second thing is drowsiness, lengthy periods spent starting into space or disorganized speech. These are things which is very important for to know as aspects of dementia with Lewy body. And here also, you can see what's happening in the progression of the Lewy body dementia. In the early stages, delusions, restlessness, REM sleep, disorder, movement difficulties, urinary issues. This is in the early stages of the Lewy body dementia. So the middle stages, like you see here, motor impairments, start not to move or do something, speech difficulties, decreased attention, paranoia, significant confusion. And there's confusion also, significant confusion as well. This is in the middle stage. In the later stages of the Lewy body dementia, we find extreme muscles rigidity. The muscles very strong, cannot move, stiff, and speech difficulties. The speech difficulties here, but the speech difficulties increase in the later stages. Sensitivity to touch, and also susceptibility to infections. So always any infections can come very easy here in this case. However, so again, we have progression of Lewy body dementia. It goes from the early stages into the middle stages, into the later stages. Patient here can move, patient here can never move, absolutely. And let's go and see a video about the Lewy body's dementia.
What is dementia with Lewy bodies? Dementia with Lewy bodies is a less common type of dementia. It is closely related to both Alzheimer's disease and Parkinson's disease. Lewy bodies are tiny clumps of protein that develop inside nerve cells. They prevent the cells from communicating properly by disrupting the important chemical messengers between them, eventually causing the cells to die. As yet, we don't know how or why Lewy bodies form. Dementia with Lewy bodies can affect any part of the brain, leading to many different symptoms. These include difficulties with movement and deterioration in physical abilities, problems with concentration and alertness that often vary from day to day, and visual hallucinations, when people see something that isn't really there. This may occur when cells involved in processing visual information are damaged, sometimes causing people misperceptions of things that are seen. As with Alzheimer's disease, the symptoms of dementia with Lewy bodies get worse as more nerve cells are destroyed or damaged. As this happens, a person's memory is more likely to be affected. Developing strategies to remember things and using memory aids may help people cope with memory loss. Dementia with Lewy bodies can cause hallucinations that may be very distressing, both to the person with dementia and those around them. The hallucinations may be of people or animals. During an hallucination, it is more helpful to reassure someone that you are there to support them, rather than tell them that what they are seeing is not real. Dementia with Lewy bodies can cause disrupted sleep, as well as vivid dreams that the person may try to act out while sleeping. Exercise during the day and reducing daytime napping can help with some of these sleep disturbances. The medications that help with the symptoms of Alzheimer's disease can also help for dementia with Lewy bodies. Some of the medications used for Parkinson's disease can be beneficial for problems with movement. Health professionals, such as neurologists, occupational therapists, and physiotherapists, can assist with any movement problems caused by the condition and try to maintain a person's independence and mobility.
Okay, guys, and I left for you the link here on the PowerPoints. Here is the link so that you can watch it whenever you wish. And like we said, we have three stages in the Lewy body dementia: early stage, middle stage, and the later stage. We'll move now into the last topic, which we'll talk about today in this lecture, about the front temporal degeneration dementia. And this type of dementia, like we see here right now, I just enlarged it for you guys so you can see it properly. Here we go. Because when the words are, it's fine like this now. Let's see. So here we go. Front temporal degeneration dementia. It is another type of dementia. It accounts for 5% only, like we said, only 5% of all dementias, and generally occurs between 40 and 60 years of old. With women, slightly more affected than men. Like we said before, also, you remember when we exposed the curves, that the dementia comes more for women in general, characterized by dramatic changes in personality, behavior, and throughout the process. So this is the frontotemporal degeneration. By the way, guys, it comes in this area of the brain, in the area, and it's called frontal, from the front. So the front area of the brain. We'll just go now. We have two videos to watch it about the front temporal dementia. We'll just watch the first one right now.
What is frontotemporal dementia? Frontotemporal dementia is the name for a range of conditions in which cells in the frontal and temporal lobes of the brain are damaged. It is a less common form of dementia, which is more likely to affect younger people, those under 65. The frontal and temporal lobes of the brain control behavior, emotional responses, and language. In the most common type of frontotemporal dementia, there is early damage to the frontal lobes. This means that people experience changes in personality and behavior, and may lose their inhibitions. In the other types of frontotemporal dementia, There is early damage to the temporal lobes. People then struggle with language, for example, in finding the right word. Frontotemporal dementia is thought to occur when abnormal forms of certain proteins, including tau, which is also involved in Alzheimer's disease, build up in nerve cells. These proteins form clumps, which are thought to cause the death of nerve cells. Unlike most other causes of dementia, which are only very rarely hereditary, there is quite often a strong family link in frontotemporal dementia. Scientists have identified genes that are thought to cause frontotemporal dementia, but our understanding of this link is still limited. Frontotemporal dementia progresses at different rates. As more areas of the brain are affected, the symptoms of the different types begin to overlap. For example, someone may initially have changes in behavior, but go on to develop difficulties with language, and vice versa. The changes in behavior caused by frontotemporal dementia can be challenging for the person with dementia and those around them. It is helpful to remember that such behaviors are a result of the condition. The person with dementia may not realize that their behavior is unusual or inappropriate. Engaging someone in enjoyable, meaningful activities and hobbies can sometimes help to prevent behaviors that can be challenging. If someone has difficulties with language, try to pay attention to their body language or learn new, non-verbal ways of communicating. Alternatively, try finding better ways to communicate verbally, such as speaking in shorter sentences. A speech and language therapist will be able to help.
So that give me an idea, and also the link, guys, I put for you the link here about the frontotemporal dementia, and we also will go to the second video here as well about also the frontotemporal dementia. Just will watch it.
Five words you pronounce wrong 2 years before your brain starts shutting down. Dementia is now known as type 3 diabetes, according to the Mayo Clinic, where doctors have made a shocking discovery that changes everything we know about memory loss and mental decline. So if you or a loved one is often forgetting things or suffering with brain fog, then you must see this. After 3,400 brain scans and years of clinical research, an award-winning brain health expert has just revealed the real root cause of memory loss and dementia. And it has nothing to do with aging, genetics, or plaques. Instead, Dr. Sam Walters discovered that memory loss is in fact caused by the consumption of 5 neurotoxic chemicals used extensively within the American food industry. These neurotoxic chemicals create a brain rot that alters your ability to properly speak and destroys mental clarity before completely erasing all your memories. Dr. Walters' discovery was a billion-dollar secret he wasn't supposed to know because it led to a clinically proven 30-second bedtime technique that can destroy the brain rot while you sleep, that you can do tonight, no matter how old you are, no matter your current condition. Tap the blue Watch Now button below for a free video. You'll see exactly how this powerful method takes on.
That was about the also about the vascular dementia. And we'll see also here what is the front temporal dementia as well.
Let's talk about frontotemporal dementia. It's a long term and a scary one, but it's important to understand what it really means. Let's break it down. Fronto and temporal refer to the parts of the brain affected by the disease, the frontal and temporal lobes. The frontal lobes are in charge of executive functions like planning, prioritizing, and multitasking. They also help you decide what's important in different social situations. For instance, it's your frontal lobes that enable you to follow directions in a recipe and to talk quietly in a library. The temporal lobes play a major role in language and emotions. They help you understand words and communicate. They also help you recognize objects and people and control your emotions and figure out what may be triggering them. Someone with damage to their temporal lobes may not understand that a hot stove is dangerous or why you're worried and upset when they try to touch it. The temporal lobes also manage memory storage. However, for most people living with frontotemporal dementia, or FTD for short, memory changes are not a major symptom. That's one of the many ways FTD is different from other common types of dementia, like Alzheimer's disease. Here's how else they compare. FTD usually affects younger adults. It is the most common form of dementia in people under the age of 60. Symptoms of FTD usually start in people aged 45 to 64, but may also occur later in life. Also, FTD is less common than Alzheimer's, and much less is known about it. It is frequently misdiagnosed as Alzheimer's, depression, or a psychiatric illness. On average, it takes 3.6 years to get an accurate diagnosis. Unfortunately, there is no cure for Alzheimer's or FTD, but some treatments are beginning to emerge. That's why it's so important to take part in clinical research if you can. When it comes to FTD, like everything, knowledge is power. It is critical to get the right diagnosis. This will help avoid potentially dangerous medications you don't need and empower you and your care partners to prepare for the future. Learn more about dementia and get the support you need.
So this is also telling me about even the differences between the front temporal dementia and Alzheimer's dementia, which are the difference between them. The frontotemporal dementia has its own symptoms as well, like we talked before. It has its own symptoms, like any other dementia. Started with emotional blunting or apathy. Notice that this is the part of the cognitive thinking and in the brain. So it affects the parts of the brain which like prioritizing or giving planning or so on. So it's also like the first thing of the symptoms of frontotemporal dementia is emotional blunting or apathy. Second symptom is repetitive or compulsive behavior. Third thing, changes in personality or behavior itself, like changing from a person, easygoing person, into very irritable person or bad mood or whatever. It changes in the personality. Number four, loss of empathy or social skills. It's shared with the other kinds of dementia. Also, we talk about this is also there in the Alzheimer and in the vascular. The needs of belonging to the others. You feel you are isolated than the others. Language difficulties as well. Impaired executive functions also. And muscle weakness or difficulties in coordination, muscle weakness. So we have here 7 aspects or symptoms of front temporal. We'll move now into the last type of dementias, which is a Parkinson's disease. Parkinson. It's like motor symptoms such as rigidity and loss of spontaneous movement. With people with DLB may also suffer from depression as well. So the Parkinson, you can see the Parkinson symptoms here. Slow movements called bradykinesia. We have also the shake Parkinson's gait. We have a rigidity here in the muscles and so on. Face masking. Tremors, hands, like the fingers and the hands is moving. Slowed reaction time, taking too much time to do the things. And the most important thing is frequent falls, of course, because of the stiffness in the muscles, I will just go now for two videos actually to talk about the Parkinson's, to show the Parkinson's problem. This is the first one. We'll go to open link. Okay, I'll just watch it here.
Parkinson's is the second most common neurodegenerative disease after Alzheimer's. The most visible features of this disease are a slowness of movement, muscle rigidity, and tremors at rest. There are also many, often debilitating, non-motor symptoms, some of which may present before the motor problems. Parkinson's affects many areas of the nervous system and different types of neurons. However, much focus has been placed on neurons in brain regions associated with the overt motor symptoms, notably a region of the midbrain called the substantia nigra pars compacta. This region forms part of a major pathway in the brain that's critical for facilitating movement. In Parkinson's, dopaminergic neurons in the substantia nigra gradually die, leading to the malfunction of this pathway and the characteristic motor problems. Drugs that replace or mimic dopamine are often used to treat these motor deficits, but they grow less effective over time. Deep brain stimulation may also be used to treat symptoms. However, no current treatment slows the neurodegeneration. A distinctive pathology in most cases of Parkinson's is clumps of misfolded proteins within neurons. Lewy bodies are the most common type. A characteristic component of these is a misfolded protein called alpha-synuclein. These molecules can form small repeated units called oligomers, or longer fibrils. Mounting evidence indicates that these are toxic to neurons and play a key role in driving Parkinson's. Unwanted proteins are normally cleared by the cell's different types of protein-degrading machinery. Some evidence points to these systems being overwhelmed by misfolded alpha-synuclein, and this might be a key factor in what kills the neurons. Parkinson's has also been linked to problems with mitochondria. Mitochondria provide cells with the energy to perform vital functions. They're highly dynamic and can fuse together or break up into smaller versions in response to a cell's energy demands. They can also be transported to areas of a cell that need them the most. However, in Parkinson's, these processes can be impaired, and mitochondria are unable to sustain proper neuronal function. As they become old or damaged, mitochondria are removed and replaced. Again, this recycling is thought to be disrupted in Parkinson's, leading to the accumulation of damaged or worn-out mitochondria. Another idea is that the cells called glia surrounding neurons may play a role in Parkinson's. As dopamine neurons are lost, one particular type of glial cell, called microglia, is thought to take up the resulting cellular debris, triggering an immune response. Once activated, they release inflammatory cytokines, which activate neighboring microglia and another type of glial cell called astrocytes. Chemicals released by activated microglia and astrocytes have been shown to injure neurons. It remains unclear which mechanisms drive the disease process in Parkinson's. What is clear is that with time, more areas of the nervous system develop pathology. And one emerging idea is that this happens through the transmission of misfolded alpha-synuclein. While the multifactorial nature of Parkinson's disease progression might make it hard to fully understand, it does provide a number of potential therapeutic targets for slowing or even halting the neurodegeneration. For example, enhancing the clearance of abnormal proteins and blocking their transmission, improving the function of mitochondria, and targeting the neuroinflammation are all currently active areas of research.
That's good enough. We also have this about the Parkinson's. We'll see it also.
84% of people believe companies. Frankly, I have no idea what the other 6% are thinking. Use science, where I explain neuroscience topics in 2 minutes or less. In this installment, I'll discuss Parkinson's disease. Parkinson's disease is considered a neurodegenerative disease because it involves the degeneration and death of neurons. It is most frequently seen in adults over the age of 50. The most recognizable symptoms of Parkinson's initially are movement-related and generally involve a tremor that is worse when a person is at rest, bradykinesia, which is slowness of movement, rigidity, and postural impairment. Parkinson's patients also often experience non-motor symptoms like cognitive impairment or psychiatric symptoms. The causes of Parkinson's are not fully understood, but a combination of genetic and environmental factors is likely involved. Parkinson's patients have low levels of the neurotransmitter dopamine in the basal ganglia, a group of structures involved with movement, among other functions. These low dopamine levels in the basal ganglia are caused by the death of dopamine neurons in a region of the basal ganglia called the substantia nigra. The substantia nigra has high numbers of dopamine neurons, but by the end stages of Parkinson's, patients have often lost more than half of the dopamine neurons in this region. The most common treatment for Parkinson's involves an attempt to restore depleted dopamine levels in the basal ganglia. Because dopamine does not cross the blood-brain barrier, dopamine cannot simply be administered to a patient. Instead, however, patients can be given a precursor to dopamine called L-DOPA. L-DOPA can cross the blood-brain barrier and is used by the brain to synthesize more dopamine. This can lead to improvement in the motor symptoms of Parkinson's, but L-DOPA does not halt the neurodegeneration that occurs in Parkinson's disease. And long-term use of L-DOPA can cause a number of side effects, including movement-related problems. So it's not a cure for the disease, and other treatments are still being explored.
Now into our own things, which we are talking about. And I will end here right now this lecture with the difference between the dementia and the Alzheimer's. Alzheimer's is one of the main components of the dementia. So the general definition, dementia is a brain-related disorder caused by diseases and other conditions. Alzheimer, a type of dementia. So the Alzheimer is a type of dementia. Like we said before, Alzheimer, take care because of the multiple choice questions. Alzheimer is one of the types of the dementia, but the most common type. And it's the most common type. We said this before when we were talking about the chart. Almost like 70% of the cases of dementia developed from Alzheimer. The causes in the dementia, many including Alzheimer. So is Alzheimer is a reason for the dementia. Disease, stroke, thyroid issues, vitamin deficiencies, like we said before, lack of vitamins B1 and B2 and B12, reaction to medicines, and brain tumors. Those are the reasons for dementia. We talked today about the Alzheimer's, and we talk about the vascular dementia, and we talk about the frontotemporal dementia, and we talk about the Parkinson's, and there is a lot of reasons to do this. But for the Alzheimer, it is unknown. But the amyloid cascade hypothesis is the most widely discussed and researched hypothesis today. Hypothesis means to suggest, just to suggest, or to guess in one of the reasons, but till the moment, is the Alzheimer reasons is unknown. Till the moment, Alzheimer reasons are unknown. Duration. The dementia, permanent damage that comes in stages. It comes in stages and it is progressive. We said it's progressive. Start from the early stages to the middle stages and to the later or the latest stages. And it is progressive. Alzheimer average from 8 to 20 years. Typical age of onset, 65 years of older or older for the dementia. Yes, 65 years also, but it can come to people in the ages, in the early ages as well, like 30s, 40s. So Alzheimer, it doesn't mean only for the old age. Symptoms, we talk about the symptoms of dementia, issues with memory, focus on attention, visual perception, reasoning, judgment, and comprehension. But for the Alzheimer, is difficulties with remembering newly learned information. With advancements, disorientation also is here. Mood and behavior changes may occur. But one thing, most of the characteristics or the symptoms are very familiar in both of them. I just want here a question to end the lecture with, compare between Alzheimer and vascular dementia. And I will end this lecture with this question. Today we talk about the 4 types of dementia. We talk about the 4 types of dementia, and the most important one of them, and the most common one of them, like around 70%, is the Alzheimer. So here, now we are coming to an end of this lecture with this question. Please not only compare between Alzheimer and vascular, and also Parkinson and front temporal dementia. So make your notes about this, make your notes about what we will talk about today, types of dementia, which is the progressive one, irreversible one. I shall see you in the next part. Thank you. I'll stop here, like I'll freeze the screen for a few minutes to get your answer, guys. I don't need, you can write it inside your notebook. This is for you guys. This is an effort for you. So you can write this inside your notebook. Thank you so much.